Healthcare education has been training the same way for 60 plus years, relying on outdated methods like 150-pound mannequins, theory, and not enough hands-on experience, which ultimately puts patients at risk. That is, until virtual reality came along. From cutting surgical training time in half to improving performance by 230%, VR is solving the biggest challenges in healthcare education while making training more repeatable, effective, and accessible more than ever before. So in this video, I'm going to explain exactly how VR is changing healthcare education, the incredible results we've seen after helping hundreds of organizations implement VR, and how you can start using this technology in your own medical training programs. Let's dive in. Healthcare education has been stuck using the same outdated methods for decades. And frankly, it's terrifying because it's basically learning on an unrealistic plastic person or by trial and error on a real person. Think about that for a second. Medical training relies on plastic humans that don't look, feel, or act real in any way. Or these apprenticeship-style programs where students watch and shadow doctors for a while. But why would this antiquated style of training be risky? Because eventually the learners have to practice on actual patients. Every mistake could literally change someone's life forever. There's no undo button when you're working on a real human being. The second major problem is that it's expensive and incredibly slow. Traditional training costs a fortune and takes way too long to produce competent healthcare workers. You need expensive equipment, cadavers, and a lot of physical space. You also need faculty and simulationists to run the equipment and facilitate the training. 4 mannequins could easily set a school back by $500,000. If you have a class of 35 learners, how do you get all students through training in one day? Or even in 1 week. And with clinical placements and shadowing, you can't really predict what real patients walk through the door. So how do you practice rare emergency scenarios when they don't actually happen that often? Because of this, for some healthcare workers, it often takes years after starting the job just to become actually really competent at these skills. And here's something that also really bothers me. Your geographic location basically determines everything. If you don't live near a top medical school, you're pretty much out of luck. Rural areas especially struggle with access to quality training. Training for rare medical scenarios is especially difficult in rural and underserved communities where resources are limited and 150-pound mannequins are overwhelmingly representative of white males, offering little realism for diverse patient populations. Here's where VR completely changes the game. According to Harvard Business Review, surgeons trained in VR improved their performance by 230% compared to those with traditional training. They completed procedures 20 times faster and performed 38% more steps correctly. Why did it work? VR provided hands-on, repeatable practice in a safe, realistic environment, building true muscle memory without risking patient safety. And what about cost savings? The cost savings are absolutely huge. Just look at Pfizer. They cut their training time by 40% while achieving improved quality in their manufacturing processes. When you're saving hundreds of hours in training time per person, that translates to massive cost savings. It also eliminates the need for expensive equipment and materials. So you're saving money while getting better results. That stat isn't an isolated one. Portland Community College reduced time to professional competency from 9 weeks down to 6 weeks for new healthcare students using VR Patients, a platform that lets educators build their own immersive medical scenarios and deploy them in VR. Whether it's training EMS or nurses, VR Patients gives students realistic, high-stakes practice that improves decision-making without putting real patients at risk. Nightingale College of Nursing is proving education deserts can be completely eliminated when you provide VR access at scale. Utilizing the same training platform as PCC, Nightingale is ensuring every nursing student, over 6,000 learners, gets a VR headset upon admission, along with 22 hours of virtual training each semester. The outcome is 100% licensure rate for their nursing students and competent healthcare professionals added to their workforce each year. Third, and this is my favorite part, suddenly world-class training is available everywhere. A student in rural Montana can receive the same quality training as someone at Harvard. They might even get to train on simulations created by Harvard. You can meet any patient from any background with a robust history and disease right from your living room. You can practice that rare surgery you might see only once in your career. And if you mess up, you just hit reset and start again. No harm done. Before I explain the specific use case of VR in education, if you're looking for an easy way to jumpstart VR at your organization, check out Arborixar in the description below. We're the leading VR device management platform, working with over 60 Fortune 500 companies. Now back to the video. Let me show you exactly how this is working in the real world. First, nursing and clinical training. Boston Children's Hospital is using VR to train nurses on critical response scenarios like sepsis, blood transfusion reactions, and infant bronchitis. Their nurses practice high-stress procedures in virtual environments with realistic chaos and sounds. Nurses have told us that during real-life emergencies, they recall their training in VR, and that helped them stay calm and respond effectively. Second, patient care and therapy. MindVR is working with tens of thousands of seniors across the US, Canada, Australia, and the UK, providing VR therapy for physical and cognitive rehabilitation. Instead of boring exercises, patients are catching virtual butterflies or playing games. They don't even realize they're doing physical therapy, which makes rehabilitation much more effective and engaging. Third, specialized medical training. Parker University uses VR for their chiropractic program, training students on procedures that are specific to their own field. They've developed 90 custom cases specific to chiropractic interventions because standard medical VR content doesn't fit their needs. Students practice patient assessment, range of motion testing, and chiropractic specific treatments in safe virtual environments. Fourth, medical procedures. Zimmer Biomet, for example, has developed FDA-cleared mixed reality navigation systems for hip replacement surgeries. Surgeons can overlay CT scans directly onto patients during surgery, getting real-time feedback as they work. They're also using VR for surgical training, allowing surgeons to practice really complex procedures repeatedly without any risk. Now, I wouldn't be giving you the full picture if I didn't also address the challenges. The first challenge is high initial investment costs. VR headsets and software aren't cheap when you're buying hundreds of them. But the truth is, you save so much money in the long term that it eventually pays for itself. Plus, as more people continue to adopt VR, prices keep dropping every year. The second challenge, and this is a big one, managing multiple VR devices at once without help is nearly impossible. Traditional device management solutions just don't work for VR because they weren't built for it. The only way companies can make it work is if they use specialized platforms like Arborixar. That's exactly why companies like Pfizer, Boston Children's Hospital, and Parker University have partnered with us to help them manage their VR programs. Over the years, we've helped hundreds of companies launch and scale virtual reality programs, and we found that having the right tool to help manage their devices is what can make or break their entire program. The third challenge is people are scared of change. Some doctors and nurses hesitate to accept this new technology. But here's the thing, VR is not replacing traditional learning. It's making it better by blending practical training with digital training. Success stories like Portland Community College's training time reduction and Nightingale Community College's 100% nursing licensure rate helps demonstrate that this stuff actually works. Now, this technology isn't just coming, it's already here. And leading healthcare organizations are using the technology to train their professionals, improve patient outcomes, and reduce costs. So if you're ready to bring VR training to your healthcare organization and ensure that your deployment is successful, you'll need the right device management platform to handle content, updates, and user experience at scale. That's where Arborixar comes in. We're the leading device management platform specifically designed for organizations scaling VR training programs. You can click the first link in the description to get started with Arborixar for free and see how we can help you successfully implement VR training at your organization. Thanks for watching, and see you in the next video.